I'm Dr. Carrie Lam, and this is Dr. Michael Lam. We're here to continue our talk about vitamin C and what are some side effects of vitamin C.
Well, to understand the side effects of vitamin C, you have to first understand how it's normally being processed. Now, vitamin C is ascorbic acid, and if you take that just as ascorbic acid form, and there are many forms, okay? But ascorbic acid is the most simple and most generic form. It goes to your stomach, and then from there it is partially absorbed, and the absorption depends on the load. That's number one variable. What is absorbed goes through the hepatic circulation and then it circulates around the body. And what is not absorbed, it goes to your gut, meaning the small bowel and the large bowel. And there, ascorbic acid or vitamin C have a osmotic effect. It's like a sponge. It absorbs water. And that's why if you have a lot of vitamin C in your body, it eventually will cause some harmless type of diarrhea. This is actually called bowel tolerance level. And when you reach that, then you have to stop. This is your body's way of telling you that you have enough, your body is saturated. So it is really not a side effect, but it's a commonly reported, and people don't understand. They think it is a side effect.
So you're saying that if you take too much vitamin C in the form of pills, then it's like it's building up in your intestines and you seem to just have it come out.
Yeah, this is very general, okay? And for some people, this bowel tolerance level could be 500 milligrams. For some people, it could be 5,000. For other people, maybe 10,000. Everyone is different because it depends on the person's constitution, the absorption, the assimilation, the gut health, the mucosa gaps, etc. That ultimately determines to what degree you're able to absorb vitamin C.
So is this normally with just a certain type of vitamin C or all vitamin Cs?
The more acidic form or more generic form it is, the more prevalent this will happen. So for example, if you have bind it with, for example, minerals, so it becomes a mineral chelated vitamin C such as calcium ascorbate or magnesium ascorbate. And in adrenal fatigue, magnesium ascorbate would cause more even loose bowel because magnesium is by itself is a relaxant. And calcium is a stimulant. So calcium causes the collagens to contract. So I won't go into the different types right now, but mineral ascorbate in general is easier on the gastric system because it's not acidic and it has a less of a tendency to be more to have the laxative type effect. Okay, it's very important that we understand that certain things are side effects, certain things are normal part of the physiological process, and you don't want to mix them up because what is normal physiological occurrence is not something that is bad. A side effect connotates as something that's undesirable. That's not part of it, and there are in every compound, not just vitamin C.
So one of the side effects or what happens with vitamin C could be the bowel tolerance and the diarrhea. So what are other types of things you can get from having too much vitamin C?
Well,
like we talked about, maybe like someone who's congested and unable to tolerate the metabolites of the vitamin C.
Yeah, if your body is such that you're weak and you're not able to process the metabolites on a promptly basis, you can get into situations where you can be anxious, you can have more fatigue, you can get agitated, so you can have anxiety, sleepless nights. These are some of the common things. In some rare cases, you can have constipation, you can have itchy ears. There's a lot of these kind of I would not say negative, but it kind of appears negative. But you just have to know how to deal with it and be on alert to see these things coming. Then you will know how to use vitamin C properly. I think that's the key, is how to use vitamin C in the right way for your body. Because remember, your body needs vitamin C. It's not able to produce. The only question is how do you get it into your system properly. It's not to say, well, I don't need vitamin C, because if you don't have vitamin C, you would die. And you want to have vitamin C. You want to have optimum amount. And if your body is one that does not do well, then you got to figure out why it's not doing well. Whether it's the delivery systems and the simulations, the receptor size, the extracellular space congestion, or it's a metabolic buildup, and then you got to figure it out, and then you resolve those things, and you'll be a happy camper.
Yeah. So there's many ways that you can get vitamin C in you, but just keep an eye out for your body's sensitivity to the vitamin C. So we talked about some of the side effects that you might have from vitamin C today, and we wish you a good day and want to empower you on your health journey.